Melly Luck and a partner in crime with Tatine on this initiative. This builds on 2 decades of work that we've been doing at our School of Medicine at the Department of Native Hawaiian Health, which has been the only indigenous department in a medical school in the nation, doing clinical care and research. And we're holding on as strong as we can to that meeting the moment. And that's part of what we are here today to do, is to meet the moment. And we are having very trying times in the US in forms of public health equity and cultural and regional initiatives like we'll be discussing today. So we're hoping that it's an ACACO thing, that we are all in this together, all who have joined and spending the time today together to empower each other and to connect with each other as we move forward. So I am sitting here in Waimanalo, which is on the east side of the island of Oahu in Hawaii, which we call the Pico, that we're in the middle of the ocean, of the largest body of water in the world, and we're in the center of it. So we are in the center of the world here in Hawaii. My favorite physical activity is in the water, for many, many ways, for diving, for surfing, for swimming. And I often as I can, I drag Tatine into the water. So I will go and start into my slides, and you may have seen other aspects of my presentation. So I'm just going to do the brief thing here and talk about updates and new directions in our collective work. Okay, next slide. The first one is I wanted to highlight is the new website that we put up with the Tatine support and the Chung Endowment. Very timely and generously helped us organize and put up all our papers and our materials for the 20 years of studies that we've developed, the interventional studies. So this is a deep, rich resource, and I hope you take a chance to take a look at it, especially if you are interested in our work as using a cultural practice or using dance as an intervention. Next slide, or next click. Yeah, so this is the picture of the website. The next project is this project that is active right now. And then if you stay for our elder panel, Kealohi Antonio will be talking more in depth about it. So I won't go into it here, but we are looking at an intervention to prevent Alzheimer's disease. And hopefully we will have findings in the next year that will say that our intervention based on our past work has held held off the deterioration from Alzheimer's disease in our kupuna or our elders, or hopefully the best case scenario shows some improvement. And then the third is a project I'm very excited about that is just in the pilot stage. They just completed their first pilot. It's Hula for Parkinson's disease, and I'm only on board as an advisor because it is neuroscience specialty area, and it is really, really goes back to the days when we were starting off with hula, because Parkinson's disease is a movement disorder, so completely different from the approaches we've taken for other health interventions. And so it's been a collaboration with Dance for PD, who have been doing this for 20 or 30 years, starting off as a practice space, starting off as a modern dance company, and branching off into using Parkinson's to address and improve, using dance as an intervention for Parkinson's disease. So I'm not gonna go any more further into it now, but maybe that's something for a future panel. See, I did it in 3 minutes. Okay, so now that's how we hope will help run. And I'm always end with sharing our many, many, many partners over the last decade.